This is the Real Health Podcast brought to you by Riordan Clinic. Our mission is to bring you the latest information and top experts in functional and integrative medicine to help you make informed decisions on your path to real health.
Hello, everybody. Welcome to another episode of the Real Health Podcast. I am Dr. Drew, and today we are flipping the script again a little bit. Dr. Ron, how's it feel being in the hot seat?
Okay.
A little bit different.
I kind of can just wait for it to come to me rather than me try to bring it to the show.
That's fair. For those of you who caught the last episode, Dr. Nisley interviewed Dr. Ron, and today we want to kind of jump off of that last episode, talk a little bit more about the future, get a little bit more in depth on some of the things that you talked about. With it being the 50th anniversary, we definitely want to take a moment, recognize you for the past, 34 years you've been here? Since 1991?
Yeah.
That's incredible. So last episode, you spoke a lot about the first and second medical revolutions, the right and left brain analogy, and the need to integrate those. You also touched on a lot of your own history. So I'm just kind of wondering, being a couple of days since then, have you had a little bit more time to reflect on everything that has happened at the Riordan Clinic, the changes and growth over the past 34 years?
Yeah, no, I'm thrilled to see that we are continuing to evolve. I think I may have mentioned the last time that I feel like we're into the third generation. You're part of that. And this third generation is where we're bringing in youth. I'm getting to be an old guy, and I'm still staying aboard here. I don't want to retire, but I want to open the door so that people, doctors like yourself, Dr. Michelle, we've got a number of fine nurses and our integrative oncologists. It's just great things are happening here, but I want to make sure we continue the momentum that we have.
Right. So over the past 34 years, what are some moments that stand out to you? Anything pivotal, anything that really kind of changed the direction of Riordan altogether?
Well, when Dr. Riordan created RECNAC, which is the research for cancer, that's cancer spelled backwards, and it was innovative research that demonstrated the power of intravenous vitamin C in terms of helping patients with cancer. A whole new modality, which is now being very justified in conventional oncology as well. I think that was a huge moment for the Riordan Clinic where we did start to get worldwide recognition. I think the next big areas, as far as I'm concerned, is the fact that we are able to use our laboratory so effectively to help patients who have not gotten results elsewhere, to help them determine what's missing. Because as Dr. Riordan would often ask in his lectures, what's the most important nutrient? Well, it's the one you're lowest in. But if you don't measure, how you're going to find that out? You can guess, you can try supplements, but you're in some ways kind of stabbing in the dark. Whereas with the laboratory, not only does it give you immediate feedback, but it becomes a baseline, because a lot of our patients, especially our staff, we get a laboratory report every year for each of our staff members, and that forms a kind of helps you develop a momentum. And if there is a drop in one of the nutrients, you can ask why, and it can very oftentimes help you figure out a disease process that you might not otherwise catch until it was far along. I was able to catch that I had a bleeding colon polyp because my blood count suddenly dropped, and I had no other reason. And so at the colonoscopy, there was a fairly big flat polyp that was taken care of. And had I not been doing those regular CBCs, I wouldn't have known about it. So the regularity with which people can come in and get their laboratory tested can be very helpful in prevention, but also in optimization, because we're not just looking for deficiencies. We're trying to figure out what's optimal for each unique individual, and we're all highly unique. And that's why just giving platitudes about take this or take that or try this or try that, it's not as scientific as it could be, based upon the resources that we now have here at the Riordan Clinic.
Right. Laboratory testing is the foundation of functional medicine. You want to find those biochemical pathways, find where the gaps are, fill those gaps. And it's you spoke to it. It's not just about the number. It's also the functioning of the patient too. So excellent. So going back to the third generation, I was just wondering, not just time, but could you kind of speak to how we got to the point of, selecting the third generation? And for clarity, could you also explain who the third generation is? I know you pointed me out. I appreciate that. But who else do you consider the third generation?
Dr. West and Dr. Dunn are naturopathic oncologists. And really, Dr. West kind of led the way. And what we found out from her is that what we were doing when patients would come, like after Dr. Riordan passed, and we had patients coming in and they had been given a diagnosis of cancer, and they were asking me, what can you do? What can we do? We would do our laboratory testing, and we would do IV vitamin C. And I might have other nutritional suggestions that I would give to them, but it was kind of hit and miss. Yeah. It was an alternative approach to cancer. What Dr. Dunn and Dr. West and Dr. Nisley herself has brought to the table is integrative care, integrative cancer care. It's really, the conference we just finished, Cancer Care Reimagined. It's seeing how patients who are dealing with a cancer diagnosis, which is probably the most dreaded thing, the most overpowering thing that can happen in a person's life, is to say, you've got cancer. Well, here at the Riordan Clinic, not only are we going to support whatever conventional therapy that they are looking into or starting or have already started, we can fill in the other side of the equation, namely look at all the nutrient levels, but not only nutrient levels, but we have something called the EnviroTox testing, where we can look at all of the toxic factors. Dr. Chin, who's our new board member, his presentation at the conference was all about toxins, how 90% of cancers probably are driven to some degree by toxic overload in the body. So you need someone that can help you investigate that possibility. But then once again, how do we integrate that knowledge into the Riordan approach, conventional oncology approach? So that's that synthesis, the corpus callosum, the two hemispheres starting to work together, getting an integrative approach to cancer. And already even University of Iowa using IV vitamin C with conventional chemotherapy in stage 4 pancreatic cancer, 2 to 3 times better survival. And so obviously we're wanting to go even more than that. We want people to defeat cancer. This is something that I think is within our grasp now, is that people not only can fight the cancer, but they can defeat it using the best of these two approaches. So that's definitely one major area that we are moving into, but I think there's even more than that.
So speaking to the third generation here, you spoke about the naturopaths that we have as well. What are some qualities that you see within this new generation that give you confidence moving forward?
Well, I think better training. I basically came in as a family physician, and I really didn't know much at all about nutrition, even though I was very interested in it, and wellness was the thing that I had been pursuing in medical school and not finding much support until I happened to run into a poster during my internship here in Wichita. Dr. Riordan was having the second International Conference on Human Functioning. Well, we just finished the 25th. So, there's been a lot of conferencing going on where the Riordan Clinic has been a leader in helping people understand what science do we have? Where does the science of wellness take us? How can we help people find optimal health in their own lives?
Right. So I think that's really important as far as moving forward. You're talking about that forward momentum of the Riordan Clinic here. And is there anything that you spoke last time, especially about what excites you and kind of defined the co-learner and expanding upon that definition, making it more interactive and maintaining connection with our co-learners. But just hearing you talk, what is it that really energizes you about the direction that Riordan Clinic is going?
Well, one of the new things that we're going to be doing, and we've just hired a new doctor, Dr. Ask. Ask. I always get her. Matter of fact, that was what I wanted to talk about. Ask, Dr. Ask.
Correct.
Is what we're really going to be talking about, because one of our areas that we could improve in was maintaining contact with our co-learners. And that actually we did a pretty good job for many years prior to the pandemic. We had the Thursday lunch and lecture,
right,
which was videotaped. So even if you weren't here in Wichita, you could get on and watch the video tape online. But we had a lot of people that would come in for lunch and listen in, and they would bring their friends in so that people could kind of experience what the Riordan approach was all about. And we lost that after the advent of COVID. We never have really gotten it back. But in this new era of the internet and YouTube, what we thought, we really need someone who could become an online presence for the Riordan Clinic. And so Dr. Axe, AKS, was her calling too. And we have hired her, and we're in the process of creating that online contact with not only our co-learners, our patients that we already have, but we want to open it up to anyone who's interested in learning more about the Riordan approach and what we are attempting to do to integrate conventional medicine with the new medicines, the functional medicines that are coming in right now.
And I think there's a important component to bringing Dr. Axe on board is it's maintaining that educational component for all of our co-learners. Dr. Nisley said in the last podcast that the root of the word doctor is essentially it's teacher, it's philosopher. Right. So you're trying to educate, which is the most important tool any physician can impart upon any kind of patient, co-learner, what have you. So I think bringing her in it's going to be incredibly important moving forward.
Yeah, the foundation of the Riordan approach is co-learning.
Yes.
And again, it doesn't matter how much the doctor specialist knows about their specialty, how that gets imparted and how the patient is able to make use of it depends upon their ability to learn, but also to work together with the doctor. So the doctor has to have a bit of humility, because even though you can learn a lot about a subject, how that gets received by the patient co-learner, that's a process too. It's a two-way street. And it hasn't always been that way in medicine. It's been that I'm the doctor, you're the patient, kind of like shut up and just do what I tell you to do.
Yeah.
And that's no longer there. I mean, it shouldn't be. Maybe it's there, but I don't think it's healthy. What's healthy is where we're working together, learning as much as we can. I'm imparting what I know. I'm picking up what the patient co-learner knows. And together we're defining a new pathway that's unique to that patient. And to me, that's the excitement. That's why every day is a new day for me. I know a lot of doctors, after they've been in practice for a long time, it just seems like ho-hum, boring, but it's not boring, because every case represents a new challenge and a new pathway to better health.
Absolutely. Then it's really sounds like getting back to basics, essentially, is education, individualized care plans. I mean, that's really the foundation of what Riordan Clinic is. Are there any other directions or even multiple directions you'd like to see a Riordan Clinic go in the future?
So there's two of them that I really wanted to talk about. We're really very interested in the whole metabolic syndrome that's encompassing Western civilization now. Namely, people are having trouble controlling their weight. They're becoming pre-diabetic. They're setting themselves up for chronic autoimmune disease. Autoimmune disease is just rampant. Gastrointestinal problems, psychiatric problems, all related to mitochondrial dysfunction. So the metabolic syndrome is where the mitochondria aren't working properly. And so we're looking into different ways now, microdosing GLP-1, using various strategies to improve adrenal functioning.
Oh, yes.
Basically orchestrating a lifestyle change that is accessible to everyone in a way that they can see themselves making progress, not only in losing weight, but gaining energy, improving their cognitive function, because that's another big area, the whole area of dementia, I can't even say it. Dementia is actually on the rise. And this is part of the metabolic syndrome as well, toxins. And so that is going to be a big area. Probably the biggest area that I see us in the next few weeks or months entering into is working with the patients who have been unable to overcome their long-haul COVID syndrome, because even though COVID seems behind us, people are still getting COVID, but there's a lot of people who never really got over COVID. And they're struggling. A lot of health practitioners themselves who are in the trenches trying to help COVID patients, they got sick and they're not well yet. And now we have developed, we didn't develop it, but we're bringing in a ultraviolet therapy that is beyond what we've done in the past, that appears to be very effective at breaking down the biofilm that is preventing the immune system from controlling the COVID virus in chronically ill patients. So we think that's going to be a huge breakthrough, and more about that in the future.
Oh, definitely. We have no idea the effects of long COVID. It has only been a few years, and to get all of that data, you're talking at least a decade, probably 2 or 3. So we still have no idea. And to be on that cutting edge is really, really exciting.
Yeah, it's a unique, we're going to be able to use our knowledge of IV vitamin C, but combining it with a special ultraviolet blood treatment, we think we have a winner in terms of, after just a few treatments, people will be able to hopefully get out of this horrible pit of fatigue. So,
Well, all of that is great and well, and I don't want to underscore any of that, because I think looking forward, that's great for the near future. You know, the next couple of weeks, like you said, a couple of months, even a couple of years. But I want you to think big. I want you to dream big here, because Riordan Clinic has been around for 50 years now, correct? If there were no object that could be any sort of restriction or hurdle, money, no object, no other barriers that you can think of, where would you want Riordan Clinic to be 50 years from today?
50 years from today, what would happen is that the integration between conventional medicine and this new medicine would have taken place. And conventional medicine would have realized that helping people become more knowledgeable, more effective in their own self-care, that this would be a foundation on which we could build a new healthcare system. Because the healthcare system we have right now is teetering.
Oh, yes.
It's teetering. It's overloaded. Chronically ill patients it's very expensive, and yet we aren't helping people learn the basics of good health and how taking really big responsibility for your health can be so freeing, because the fear of chronic illness, the threat of not being able to work, the fear of death, because people get cancer, it's like a death sentence.
Right.
What if we could get it to when people start to get their symptoms, or even before they get their symptoms, they would do regular testing, they would be involved in lifestyle groups, support groups. They would basically be choosing to live a life of better health from even their youngest age, teaching it in grade school, kindergarten. Because right now, I know my wife as a second grade teacher will tell you that it's just horrible to see what kids bring to school for their lunches or their snacks.
Oh, yes.
So there's a lack of education about nutrition, how the importance of sleep, how important stress management and maintaining healthy relationships. All of that's very important, let alone nutrition, and then the whole issue of environmental toxins, how that is weighing down on people. If everyone was thoroughly educated in this field and were actively engaged in managing this, we could dramatically reduce healthcare costs and improve quality of life.
That's very well said. Nutrition is the first and best medicine that we were ever given. And I think you hit the nail on the head there, is really trying to get ahead of these things before you have those symptoms and be truly preventative. What is, with the last few minutes here, what is your hope with this new third generation? What is your hope for them moving forward, whether it be professionally, personally, what have you?
My hope would be that I know for when I was growing up, the doctor in our small town was a very important person in our town. And to become a doctor or a nurse or someone in the medical field was very, very highly valued. And I think that still is the case, but I think the shine of that has gotten a little bit dull. I would like for people who are thinking about going into medicine or healthcare, all the various facets of healthcare, would see that this new third generation idea of bringing in the wellness side and completely integrating it with the treatment side, the acute care side of medicine, that this could actually save medicine.
Oh, yes.
Because right now it's kind of teetering. The costs are just, it's the most expensive thing in our national budget is healthcare. It's
right.
Like over 20% of our costs are going to illness care.
Yeah.
Illness care. And what we're talking about is that if we could really get wellness care, even beyond wellness, this optimal health care, really intrinsic in our schooling and in our thinking and in the way doctors are trained, this could pull us out of this kind of like this downward spiral that we're stuck in. So, but it's there. We have the beginnings of it, but there's still a bit of a resistance. There's this idea that it's not scientific. It's very scientific. The research
Yes.
is there, but it has to be applied, and people have to kind of open their minds and think about what this could do to improve quality of life in our country and everything. If health improves, everything else is going to improve.
Oh, absolutely. You said it right there. If health improves, everything else improves. The journey of life is to find your own health, in my opinion. So, Dr. Ron, it has been 50 years since Riordan Clinic has been in existence. You have been here for 34 of those years. We thank you for everything you have done to get Riordan Clinic to this point. Any last thoughts on 50 years?
Well, I'm grateful for you in that you are. Well, actually, you've had this in your roots. I think the whole osteopathic philosophy, it's right there that your mentor was able to vision this and put it into a healthcare system. But now we take the next big jump, and I'm thankful for you and all of our young doctors that they are willing to jump on board and continue the ongoing growth of this philosophy of optimal health. And so thank you for your part in this as well.
Thank you, Dr. Ron. I appreciate the opportunity. And everyone else out there listening, thank you so much for listening to the Real Health Podcast.
Thank you for listening to the Real Health Podcast. If you enjoyed this episode, be sure to subscribe and leave us a review. You can also find all of the episodes and show notes over at realhealthpodcast.org. Also, be sure to visit riordanclinic.org, where you will find hundreds of videos and articles to help you create your own version of real health.